There's just been so much uncertainty and fear and hesitancy.
I believe that it was almost a perfect storm.
This vaccine is a way for us to turn the corner on this pandemic.
I've really tried to help be a bridge within our communities to say why I believe the vaccine is safe and why I believe we should get the vaccine to help improve our outcomes.
You already got your vaccine,
yes,
and you're now kind of about March 16th, 2020, just in my office, and two of our patients who were at a ski resort in Utah called me saying they were having these symptoms of respiratory problems. They were actually the first two positive patients in the county. They were African American, they were in their mid-50s, and we began kind of our COVID Allegheny County experience right here.
We administered our first vaccine on December the 29th. We've been administering the vaccine at Eastminster Church, which is right next to our East Liberty Family Health Care Center office.
Our minority elderly population, our minority population with pre-existing conditions are those of lower income. They're the most vulnerable right now.
If you look at rates of diabetes, hypertension, chronic illness, the rates are higher in the Black and brown community. So if you already have chronic health issues, those conditions make you more vulnerable to the serious illness that this can be. And the other thing is just access to health care.
I think that the reason why people have a lot of distrust over this vaccine is just the speed at which it has become available.
Because there is a huge infodemic going on where there's misinformation on social media and social networks.
We could talk about Henrietta Lacks and the use of her cells in studies for cancer. We could talk about the Tuskegee syphilis experiment. We can talk about the eugenics experiments in Virginia. So there is proof that medicine exploits Black people or people of color.
I was a little hesitant at first, but then I was like, science. I believe in science. This is not their first rodeo.
I was skeptical about getting in the beginning. I called my PCP, and I love him a lot because he stays on me. So when I asked him, should I get the shot, he said, Terry, get it.
We have administered over 575,000 COVID vaccines to our patients. We are in over 200 locations, our pharmacies. We are also working with the Black Equity Coalition to identify communities that would benefit from us going into the community and giving COVID-19 vaccines.
More than 500,000 people have died from this, just here in the United States, okay? So, I mean, if that's not enough to cause you to protect yourself from it, I don't know what else to say to you. In my family, we've already lost 3.
I'm highly asthmatic myself, so, just to protect my family and my friends and people, just anyone, just so I'm not the one that's carrying it and giving it to someone else.
Black people shouldn't be fighting this. And how many more of us have to die before they realize that there's really not an alternative here?
The Latino community in southwestern Pennsylvania is a large and growing community. I think a large segment of the population is getting the vaccine. There might be some hesitancy, but a lot of times when just ask the questions, they approach the providers, they get reassured, and they get vaccinated.
You feel okay? Now that I have the vaccine, I feel safe and I have a confidence of being out in the world.
Get the shot, get the vaccine.
It's just about being smart.